Hi, Prof.
Hi.
How are you?
Is the slide correct, Chief?
Yeah, live already, eh?
Okay.
I haven't seen the slide yet. Can you start the slide?
Okay. Hi, ladies and gentlemen, boys and girls, ESCO and COM members, NSCMH staff and doctors. Today, for the first time in NSCMH, we are going to have duplex speakers in Facebook Live talk. We are going to handle a very, very common topic, hypertension, or otherwise in common language, high blood pressure. So, myself, I am Prof. Dato Dr. Sree, Group CEO of this hospital. I'm also a physician, and my colleague is a consultant physician, Dr. Lim Teng Wei. Dr. Lim?
Hi, Prof. Prof, if you don't mind, can you give me the slides?
Okay, right. Thank you.
Sure. Can you adjust the slides, Prof?
Yeah. 1 minute.
Yep.
Okay, Dr. Lim.
Yep. Sorry, because I have some technical issue here. I couldn't get the slides. Do you mind the IT people to come, Prof?
Yep.
I'm not receiving the slides here. Okay. Okay, can you hear me, Prof? Yep, I got a slide. Thanks, Prof.
Okay.
Thanks, Prof. So, hi everyone. I'm Dr. Lim Teng Wei from NSCMH. So, currently I'm a consultant physician for NSCMH Medical Center. So, it's my pleasure to have you guys today for this Facebook Live talk. So, just a reminder, you guys have any comment or any questions, you can feel free to just type the questions and anything, we'll try to answer it for you. Okay, so let's begin. Sure?
Yep.
Okay, as Prof mentioned, the topic today I'm talking about is high blood pressure or hypertension. I'm sure most of you have heard about it, hypertension, high blood pressure. So today I'm giving a talk to give the details of high blood pressure and also the causes, the complication, and the treatment. So what a person should do or what a person should know if he's diagnosed with hypertension. So in hypertension, basically two measurements we take. It's called systolic blood pressure, or we usually call it upper blood pressure or upper BP. That is the pressure we measure when the heart is contracting. The second important measurement we take is the diastolic blood pressure. We call it the lower blood pressure or lower BP is here. So that is the measurement we take when the heart is relaxing. So most commonly, we take, and the most convenient way of taking a blood pressure is through on the arms. Okay, so we just move on. So the latest definition in 2017 American Hypertension Guidelines. So how we classify hypertension. In a person, upper blood pressure should be less than 120 mmHg, and provided the lower diastolic pressure or the lower BP should be less than 80. So it's considered as a normal tension, if not having hypertension. If the pressure goes beyond 120 to 129 upper, and the lower goes beyond sorry, lower dose less than 80, we classify them as elevated hypertension or pre-hypertension, elevated BP. So once a patient's blood pressure falls above 130 to 139 upper pressure or 80 to 89, we will classify this person having hypertension stage 1. Likewise, the pressure above 140 upper pressure or the diastolic blood pressure more than 90, so you also classify as stage 2. Just take note the word and or. So to diagnose a patient with hypertension, we actually require either one of the reading, the upper or the lower reading. So even you have for example, you have a reading of 140, 80. So actually you are considered hypertension because upper limb is already above the normal value. Okay. So coming to how we measure blood pressure. So we can take our blood pressure very conveniently at home, at work, anywhere. So all you need is just a digital blood pressure monitor machine as shown in the diagram. So you can measure your blood pressure anytime, anywhere, and it's very portable. You can carry along anywhere you want. So you can get this digital blood pressure machine anywhere in the pharmacies or medical equipment centers. Okay, it's very cheap. And you can measure it. And you don't need very complicated instructions. It's very easy to use. And usually you don't need anyone to assist. You can monitor yourself. And just take note, usually blood pressure at home will be slightly lower than the blood pressure taken in hospital or at clinics. So approximately 5 mm lower. Okay. So once a patient is diagnosed with hypertension, of course, we have start treatment and there's a target blood pressure we have to maintain. So in order to prevent complication related to hypertension, that will come in later. So in general, a blood pressure of less than 140/90 is our ideal target BP. So in special groups like diabetes, heart failure, or those patients with kidney problems and age above 65, usually it tends to reduce the blood pressure slightly to 125, 130 the upper, and the lower will reduce it to around 80. So, but in special cases, in those elderly case where the age is above 75 years old, we tend to maintain the blood pressure slightly higher, 135 to 140 upper pressure. The reason behind this group of patients, they tend to develop hypotension, or we call it low BP related complication, if we treat too aggressively, bringing down the BP too much. So in this age group, we tend to maintain the BP around 135 to 140. And most patients, you can see from the slides, according to the studies, most patients and most people do not know they have hypertension. 1 in 4, approximately 25% of men have hypertension. And 1 in 5, approximately 20% of women have hypertension. And the risk of developing hypertension is around 90% when the age group falls between 55 to 65. So this is the most common age group that get hypertension, but that doesn't mean that you won't get hypertension before that or after that. Okay, you still will get hypertension. So it's advisable to monitor your blood pressure regularly. Okay, just to show you a diagram, okay, you can see what happens in a normal patient and a patient with hypertension. In a patient with no hypertension, usually the heart will pump normally and the blood flows easily through, in and out of the heart. But in the patient with hypertension, the pressure is high. So the heart has to pump harder in order for the blood to flow through the blood vessels of the heart. So I can show you another diagram. Okay, this is a cross-sectional view of the artery. So in patient with normal or in patient with hypertension, you can see. So in patient with normal, the blood flows easily because the lumen of the vessel is broad, it's wide, and the thickness of the vessel is very thin. So blood flows easily. But this happens when the patient is having hypertension, the lumen becomes thickened and the blood flow becomes more difficult. So the heart has to pump harder in order for the blood to flow through the heart, the rest of the body. And you can see the cross-section of the artery. The patient with no hypertension, the artery wall is very thin and the blood flow is significant, is flowing smoothly. But if you see the artery in the patient with hypertension is stiff and thickened, the amount of blood flow is reduced. So therefore, the heart has to pump harder. So in long term, we will result in complications that I will mention later. So we are calling it hypertension related complications. So this is reason why we have to treat hypertension early and aggressively to prevent complications. So once the complication kicks in, or once you develop complication, so it will be difficult for us to treat. So, okay. So in the next slides, I will pass over to Prof. Sree. So we'll talk about the causes and also the complication of hypertension. Also, we touch upon the treatment. So a reminder, feel free to give your comment, or if you like to ask any question, we'll try to answer your questions. Okay, Prof, can I pass over to you?
Hey, thank you, Dr. Lim. Thank you very much indeed. Of course, you have given a good head start, especially the initial aspect of hypertension. Thank you very much indeed. Okay, I will take the rest of the slides. Now, coming to causes, it's very interesting to note that in 95% of the population who have hypertension, the cause is unknown. But definitely we know some possible causes. If you look at this, stress is one important cause. Too much of salt is another cause. Advancing age is another. And of course, hereditary, meaning to say if parents have hypertension, the chances of developing hypertension in their children is definitely high. And obesity, increase in weight is another cause for developing hypertension. Other causes would be inactivity, right? Whenever there's an inactivity, or you also tend to put on weight, is another cause. Alcohol, excessive alcohol is another cause. Of course, if you see this, look, this gentleman is already on the table, his head, that means he has taken too much of alcohol. And next will be smoking. Complications. It is definitely a silent killer because you do not know. Suddenly it just strikes in an uncontrolled hypertension. Number one would be stroke, where either there will be a blood clot. If you look at it here, the blood cannot flow through. The other one is a vessel can rupture. It's known as a hemorrhagic stroke due to bleeding, heart attack, blindness, and kidney failure. Stroke. Of course, you can see the clot here. One half of the body in a stroke will become weak, left-sided or right-sided. But what is very important is it a stroke? Act fast. Fast. F. F is for face. One side of face will droop, meaning to say asymmetry. If you look at this diagram, the left side of the face is drooping. A for arm, arm weakness. Here you can see left arm is weak. The right arm is at 90 degrees. This is sagging. And the speech becomes difficult or incoherent. S. And T means critical, 911. Call for an ambulance. And most probably, this particular person is having stroke. Heart attack. Of course, chest pain is the hallmark for heart attack, one of the symptoms. Then the other symptom is, you look at this, right on the top is number 2, that means dizziness. The pain can go to the jaws. Also, the pain can go to one of the arms, especially the left arm, number 4. And number 5, you can have shortness of breath. This is the postmortem specimen of the heart. And you can see here, right at the bottom, this is heart attack. Of course, when you have a cross section, this portion is very clearly seen. It's a heart attack and there is a blood clot there. Moving on to eye complication, it's the normal eye, front portion of the eye here. In the back portion, this is the retina, red in color. This is where in hypertension, the complication arises. Now, when the doctor sees through the eye, that is using an ophthalmoscope, or when he does a fundoscopy, this is a normal retina, which I'm talking, the red portion. This is normal. Now here you see the difference. Above is just tomato red. Here is all gray color. The small red portions are actually bleeding in the retina, the back portion of the eye, and the white is all fluids which have come out of the vessel. So a lot of fluid has come out. So this leads to blindness. Coming to kidney failure, you can see here one kidney has shrunken, is a diseased kidney. The other kidney is a normal kidney, right? Just for comparison. So the kidney shrinks in heart failure. You have various treatments, hemodialysis. By using a machine, the blood can be cleaned, say 3 times in a week. Peritoneal dialysis, where a tube can be inserted permanently into the abdomen and fluid can be pumped in and washing can be done. Of course, you've heard about kidney transplant. You can take a donor kidney, one kidney, and transplant to the kidney failure patient. People have asked whether can we avoid taking medication? Yes, of course. Why not? Lifestyle modification. Eat less salt. Food rich in potassium. We have asparagus and lots of other things rich in potassium. Coconut juice, so on and so forth. Weight loss. Of course, if you go down, exercise is a form of losing weight. DASH diet. Diet advice to stop hypertension. Here you have asparagus, bananas, tomatoes, etc. Exercise. Regularly doing exercise brings down high blood pressure. Limit your alcohol intake. Now, this is lifestyle modifications does work very well when the hypertension or the high blood pressure is just above the upper limit. But a time will come wherein slowly the pressure keeps on increasing. Apart from lifestyle modification, you may have to take some amount of antihypertensive, otherwise tablets for hypertension. Tablets, well, I've simplified the lots of tablets. We have enough of drugs to control hypertension. To simplify, we have A, alpha blockers, etc. B for beta blockers, C, calcium channel blockers, and D are diuretics, water tablets. Your doctor can pick up from any one of these groups. These I've just simplified as A, B, C, D. You can also visit our website, that is our Ministry of Health website under Academy of Medicine, okay, Malaysia, CPG, if you want more information. Well, thank you very much for viewing our live talk on Facebook, and I'll leave this slide for you to just go through. Meanwhile, we'll wait for questions from viewers, okay, and then we will try our level best to answer the questions as we wait.
Thanks, Prof.
Thank you, Lim.
Prof, so you don't mind I ask you a question? Since we're waiting for questions from the audience, so I have a few questions I got from. So they ask if a person wants to check how frequent he should check his blood pressure in order so that he won't miss his hypertension, or he or she. So how frequent we should check the BP?
Okay, based on what is existing, if your age below 40 years old, okay, you no need to frequently check your blood pressure. It becomes more like an opportunistic. When you have an opportunity to visit a doctor, you can quickly measure your blood pressure, or if so, once a year. But once your age is jumping above 40 years old, then you need to have a frequent checkup. Okay, more so if you have risk factors for developing hypertension, especially family history, obese, not much of exercise, then it's best that you check probably once in 6 months or more frequent than that. Okay, basically. But of course, if you're already touching 55 and above, then it's going to be more frequent. Even it can go for, say, once in every month. But there's no definite guidelines.
Thanks, Prof. So in my opinion, Prof, since as I mentioned, the BP is so easily, I mean, to have measure BP is so easy. We can actually measure, I mean, with the machine, it's so convenient. So no harm doing once or twice a month, just monitor BP irrespective of age group. That's my advice to patient usually. What do you think?
Yeah, of course, when you have your own blood pressure monitoring, you can do it more frequent. Okay, but I find that most of my patients, only when they have hypertension, they go and buy the machine on the advice of the doctor. But once they are normal, not many of them buy. But if one member of the family is having hypertension, for example, the father or mother, once they buy the machine, no harm in other members of the family who have a normal BP can also do a frequent checkup.
So since you probably said some patient may have hypertension in family members, so it's no harm doing a blood pressure at home, isn't it? It costs nothing and it won't cost anything. It's easy to use, so you can check your BP regularly. So
Okay.
if you notice your BP is increasing or is elevated, so it's advisable to see a doctor to get further confirmation, or if necessary, start medication. So this is.
That's a question, Dr. Lim.
Yeah, sure.
Okay, Prof and Dr. Lim, some people having low blood pressure. Okay, any comments?
So what's the definition of what do you think? What's the definition of low blood pressure? To that actually can comment?
Okay, maybe I'll address this. Low blood pressure is anything between 90 to 100, the upper level.
Yes.
Lower level around, say, 50 to 55. Okay. Now, first thing is that, is this low pressure is normal for them? Because there are some of my patients, when they have a low blood pressure, they come and comment, my pressure is always 90. How long? Oh, since the days I've been checking, it's already 90. Do you have symptoms? If they say no symptoms, looks like that 90 or 100 is quite normal for them.
True.
But if they have symptoms, then something is wrong.
True.
First and foremost is, first, what is the cause for the low blood pressure that we need to investigate? Sometimes I find that very rarely patients have been diagnosed to have hypertension, okay, on a single reading, okay, just above the upper limit of normal, and medications have been started. Once you start a medication, the blood pressure will drop, because blood pressure has to be taken several times at different days in a week or a few weeks before labeling that individual as hypertension. And furthermore, a single reading, especially when the patient is not in a normal state, maybe stressed out or in severe pain, and the blood pressure has gone up, and immediately if a doctor starts, then one can have a low blood pressure. Of course, there are other causes for low blood pressure, especially patients who are dehydrated, not taking enough of fluid, or certain nerve problems. They can have a low BP. Okay, another question has come up here.
Yes.
Maybe I read this question.
Sure, Prof.
Doctor, can low blood pressure cause headache? Okay, yes. You want to handle or shall I handle?
Yes, sure, no problem. I can handle. So
Okay.
it's very subjective when the person asks you what's low pressure. Usually, I will ask the patient, you have to measure your pressure first. And what you mean by low? So we have to find. That's why in the beginning of my slide, I said the systolic and the diastolic pressure both are very important. But usually in low pressure, the systolic, we'll look at the systolic. So by definition, if your low systolic is less than 90, then we'll look into it. Most probably patient will have a low blood pressure. On top of that, patient's body weight is also very important. If I have some patients, the body weight is quite slim, the body weight is less than 40 or 30 kilo, I expect their pressure to be slightly lower than compared to patient with a more obese. Prof?
Okay, good. There's one more question coming up. What are the symptoms of having high blood pressure? If possible, the person is asymptomatic. Is it possible the patient can be asymptomatic? Well, yes, possible. Most probably only when a patient is having extremely high blood pressure, they have headache. Okay, especially when the upper limit of the blood pressure is more than 180, they will have headache. Otherwise, usually by and large is a silent killer. You do not know until you go and check it. Okay, right. Yes, your question is right. Is it possible the patient can be asymptomatic? Definitely. Only extremely high. I've seen patients walking around with more than 200 yet no symptoms. I have seen patients. So it can be really, really asymptomatic. Another question coming up
Sure.
is, if high blood pressure patient, do they still suitable for exercising?
Okay, first thing I will clarify, if the patient is having high blood pressure, is it confirmed hypertension or not? If it is having a high blood pressure, persistent high pressure, I would suggest you confirm, check it, and see a doctor. So once the doctor confirms his hypertension, he should start treatment. So treatment, once you started the pressure, once the pressure is normalized, of course, he can go for his regular exercising. So if the pressure is too high, if you go for exercising, the pressure may even shoot up further. Do you agree, Prof?
Yeah, I agree with you. There's another question coming up. Doctor, can I stop taking blood pressure medication once my blood pressure is well controlled with medication for years?
Prof, I think this is the question that we always get from our patient, right? Do you agree? So, okay, we go back to the basic. So, Prof, you have mentioned the causes of hypertension. Do you notice the previous slide that we mentioned? 95% of patients with hypertension has unknown cause. What do you mean by unknown cause? No cause can be found. So, in this sort of patient, okay, the reason why hypertension, no one can explain. Okay, so they may require hypertension medication, and then they will usually ask me, use the word, can hypertension be cured totally? So, sorry to say, in this patient, because we don't know the cause, 95% of patients with hypertension, we don't know the cause. So hypertension cannot be cured. What we can say, hypertension can be treated and it can be controlled well. So by using this word treated and controlled well, why? So if your pressure is treated and controlled well within the target range, so you will be just like normal people. You won't develop those hypertension, uncontrolled hypertension related complications. So likewise, we're coming back to that question. So if your pressure is well controlled, your pressure is well controlled, I'm assuming you're taking a good lifestyle modification on top of that with medication. So these two things is helping you to control your pressure. So if you stop the medication, most probably the pressure will go back high. So the answer most likely is no, or say in my opinion. What do you think, Prof?
Yeah, true. Agree. Okay, there's one came out in the WhatsApp, okay, message. Can Tai Chi, meditation, yoga, can it cure hypertension? Well, it's very interesting. Studies have shown that yes, Tai Chi, etc., meditation, it does reduce hypertension, but it's only in a very slight way, say about 5 millimeters of mercury. But there are lots and lots of other benefits of Tai Chi, yoga, meditation, okay? Things like yoga, your joints become very flexible, you firm up your muscle, it gives a peace of mind. So also Tai Chi is a form of a physical exercise. Meditation, it really makes your mind peaceful, your thinking will be good, and all the three will induce good sleep at night. You have a very peaceful sleep, peace of mind. So definitely there is a value that is beyond controlling hypertension in a very small way. There are lots of other benefits of yoga, Tai Chi, and meditation. There's another question. If I missed.
Prof, I think so. Yoga or Tai Chi, I will take it as more.
There's another question coming up. Doctor, I was told, but I think this particular viewer is still uploading.
Yes.
The question.
I was told. Yeah, I did notice that. Doctor, I was told. Okay. So, coming to your question, one of patients usually commonly ask me, so once I take hypertension medicine, do I have to take a lot of pills, a lot of time, the frequency 3-4 times a day? So rest assured, nowadays hypertension medications has advanced, and we have most hypertension medication usually is daily dosing. Okay, and certain brands they have combination 2-in-1, 3-in-1. So the pill load, so not to worry, you won't have to swallow a lot of pills. Do you agree, Prof? So maybe you have take 2-in-1, 3-in-1. So all is that 1 or 2 tablets the most a day.
Yeah.
So in most cases of mild hypertension, mild to moderate hypertension. Okay, no complication. Of course, if there's hypertension related complications, you not only have to take hypertension medication, you have to take other medication to control the complication. And hypertension sometimes may come with diabetes, cholesterol, likewise. So you have to take the medication for diabetes.
Another question is cropped up, Dr. Lim.
Yeah.
Blood pressure medication, can it cause kidney failure? Is it true?
Okay, that's a good answer. Well, you want to answer or a good question?
Right. This most patients ask. Somehow,
yes,
medication and kidney, they always ask.
Yes.
Okay, whether by taking this medication, whether it can harm the kidneys. But this is true for painkillers. True
Yes.
for painkillers. But the reverse is not true. Whether by taking blood pressure medications, whether it can harm the kidney. But the answer is only when you don't take, it will harm the kidney. When you don't take, what is going to happen? Blood pressure is going to go up once you stop taking, and that will harm the kidney, not the other way around. So as far as the painkillers are concerned, yes, it is very much true, plus some other medications, not the other way. By taking medications for hypertension, that is going to harm the kidney, the answer is no.
Yes, just to add on a bit. So patient always ask me, as you say, the pressure can harm my kidney. No, actually, blood pressure medicine don't harm the kidney. It's the pressure, uncontrolled hypertension harms the kidney. So, but I make it clear, if the hypertension that causes the kidney failure, certain medication for hypertension has to be stopped. Okay, so to clarify that. So certain medication is not suitable when patient will already develop kidney failure or kidney problems. So we have to reduce the dose or even change to another more suitable medication for patients who have kidney failure or kidney problems.
Okay, so it's changing, but by themselves do not harm,
yes,
provided if you don't reduce. Okay,
yes,
another question has come up. Is it advisable to take supplements like garlic oil, fish oil, and coenzyme Q10?
Coenzyme Q10. So I would say all this is just supplements. So actually, there's no harm taking it, but usually, in my opinion, don't overdo it. You know, some have a patient with taking Q10 10 tablets or fish oil 10 20 tablets, thinking that it helps. So supplement is always just supplements. So supplement is just adding on. So helping, I still believe if you're already diagnosed with hypertension, medication, you still have to take hypertension medication, but no harm taking some supplements. What do you think, Prof?
Yes, true. But you know, coenzyme Q, a lot of people are taking.
Yes.
But I just want to make a small comment on fish oil, because fish oil can be a blood thinner. So you have to be careful on that. Don't overdo things. No. There's another question has come up. Hypertension complications reversible?
Hypertension complication reversible.
Okay.
So, okay.
You want me to take up the question?
Sure. Okay.
Or you want to handle the
I'll
question?
just take it. Okay. Okay.
Okay. We start with say blindness.
Yeah.
Okay.
So we just take, for example, heart attack. So if a patient with hypertension, he has already developed a heart attack. So in heart attack, the damage is already done to the heart. So by taking hypertension medication, if a patient have already a heart attack, only diagnose hypertension after having a heart attack. So damage is done to the heart. So by taking hypertension medication is to reduce the further damage to the heart. So in other words, to prevent a second heart attack. So whatever damage is done, so most probably it cannot be reversed. So it only can be minimized. So that's the reason why we emphasize treat hypertension before it develops before complication kicks in. Prevention is always the most important rather than treatment. Rather than if you develop complication and you start treating, of course you won't be recovered fully. Do you agree, Prof?
Agree. That means what you're trying to say that once a complication has set in,
yes,
it's very difficult. But if you start controlling the blood pressure, then we can arrest the progression of the complication.
Yes.
Okay. Waiting for more questions.
So far.
Okay.
Should we wait for more questions? Or?
Yes, one more. I'm not too sure whether we have addressed. Doctor, can low blood pressure cause headache? Okay, that one is actually, it produces lightheadedness, dizzy spells. You know, once the blood pressure drops, you have dizzy spells, giddiness, etc. Sometimes it's very, very low, then you can even have a faint, okay, faintness, and you can fall to the ground if the blood pressure is really, really low. So you will low blood pressure. If it's extremely low, you will have symptoms. But on the other hand, if a person is already having low blood pressure for a very long time, I think it's normal for that person.
Yeah, I agree. Prof, I got a question, I think addressed to me. Say, hi, Dr. Lim, does pressure medication, BP medication benefit the patient?
Mm.
As we mentioned, of course, if a patient is diagnosed with hypertension, of course, so BP medication, of course, will benefit the patient because it will reduce, will control the blood pressure, and it will prevent the patient from developing hypertension-related complication, of course. So definitely, if a patient is diagnosed with hypertension, BP medication definitely will benefit the patient in the long run.
Okay,
Yes.
there's two more questions coming up. Hi, Dr. Lim. Does BP medication benefit the patient?
Yeah, that's the question that was.
The other question is, I was diagnosed by the doctor to have mild BP and was prescribed amlodipine 5 milligram. Can I choose to not to take it? I will be good for 1 month. Don't eat oily food. Is it possible? Yes. Why not? What you can do is you're having a mildly elevated. So you start your lifestyle modification by exercising, by reducing your weight, reducing your salt. What will happen is, after some time, if you find your blood pressure is normal, on the advice of the doctor, look here, my lifestyle modification is working very well. My blood pressure is back to normal for a couple of weeks or months. Do you think I can give it a try to stop the medication? The doctor may advise, well, your lifestyle modifications really, really worked. Well, you can stop, but we need to monitor your blood pressure. That is permissible. That means you must regularly check up and see. Because in time to come, you may not require the tablets for a couple of months. And once, as the age advances, the blood pressure might go up. So we cannot let down our guards and say that, okay, my hypertension is cured, I can stop. Not really, but you need to keep on checking. If it goes up after several months, then you have to restart again.
Prof, just to add on that, so actually by guidelines, European Society, American Society, stage 1 hypertension, usually we can say is manageable with lifestyle modification for 3 to 6 months before we start medication. So actually, the chance we can, before we start antihypertensive for patient with stage 1 hypertension, usually I will give a chance of, maybe give it some time for the patient, 3 to 6 months for lifestyle modification. If the pressure comes down, so that means the lifestyle is working, so we can keep the patient medicine free for a few months or years.
Okay. So there's a few more questions. Few more questions. Maybe we go very fast.
Yeah.
Okay. Sorry, doctor. Can BP medication be taken at night? Okay, I'll handle this question. Why not? But more so, if you're on 2 medication, one can be taken in the morning, the other one can be taken at night. Especially more so when you find that, okay, my BP is high in the morning, but then in the evening my BP is normal. That means something is wrong in the morning. The medications, both the medication we are taking in the morning, probably it is not covering for 24 hours. By the time at the end of the day or at night, the levels of the drugs are coming down and early morning blood pressure is up. In which case, you take one of the medications at night, the other one in the morning to cover the 24 hours period. Another question coming up. Hi, doctor. For elderly, 60 years and above, the BP on medication is 170 by 80. Is the systolic BP required to bring it down for further treatment? Okay, 60-year-old, Dr. Lim, 170 by 80.
Okay, just now previous slide, I mentioned with the age group within 65 and below, 65 to 75, so usually we maintain the blood pressure between 125 to 130. Okay, so with a systolic blood pressure of 170, but I wouldn't take as a single reading. Usually I would say monitor. If it's persistently 170, 80, definitely we need to bring down the BP. But just be cautious, as I mentioned, we cannot be too aggressive bringing down BP too much. So I would suggest see a doctor, adjust the medication. Maybe we have to titrate up a bit slightly and closely monitor the pressure. So not to go too aggressive, suddenly bringing up the BP, bringing down BP too much. So as I said, maintain around 120 to 125 to 130. That would be the idea. But if you ask me, persistent 170, 80, definitely you have to do definitely we have to increase a bit of the medication.
That's on clarification. Probably the audience can ask questions in Chinese also. Dr. Lim will handle. In Bahasa Malaysia, both can handle. In Tamil, I will handle. Okay. Now there's a question here. It says that some BP medications are requested to be taken at night. Not really. You said unless you're taking two medications, you have to take one in the morning and one in the evening. More so if your morning blood pressure is high, which I've answered.
Yeah.
And the other thing is that, ask any questions. Okay, we are requesting the audience to ask more questions. Let's wait and see what's happening. Okay, there's a question here, no?
Yeah.
What if the patient is having white coat hypertension? How to treat? Wow. White coat hypertension. Okay, let's address this one. It's a very interesting question. Well, we avoided the particular topic of white coat hypertension. White coat hypertension means who wears a white coat? The doctor is wearing a white coat. So, white coat hypertension is otherwise known as clinic hypertension or hospital hypertension. The moment they hear they're going to the hospital, the fear of seeing a doctor, the BP goes up. Okay, this is known as a white coat hypertension. In this case, if a person is having a white coat hypertension, if you treat this patient, when they go back home, when they take the medication at home, the blood pressure is actually normal at home. When they take the medication, the BP will drop. So if a patient comes back and report that, doctor, I took the medication but having dizzy spells, then you must start suspecting he's having a white coat hypertension. The best would be ask him to get a BP measurement apparatus, buy from any pharmacy, then check the BP at home. You will be shocked to know that the BP will be normal at home, but then when they come to the clinic, the BP just shoots up. And the patient themselves will say that at home my BP is normal. Whenever I want to come and see Prof. Dato Sree, the BP went up. Then you know already. Even when I see Dr. Lim, the BP goes up. Then you must start suspecting white coat hypertension. To answer your question, white coat hypertension need to be diagnosed carefully. It needs a lot of understanding and what the patient complains, and they do not need to treat white coat hypertension. So very interesting question. Thank you very much to the viewer who asked this question.
Oh, Prof, I have a patient.
Okay.
So usually when he comes to hospital, the BP will be high. So when he claims the BP at home will be normal. So what's the range you think? By definition, white coat hypertension should be more than a difference at home BP and BP at clinic should be more than 50 millimeters of mercury. That's the time we should suspect white coat hypertension. So if a difference, as I mentioned previously, home BP usually will be slightly lower than BP taken in hospital or in clinics. So between the 5 millimeters to 10 millimeters mercury range. So if a patient fall within that range, I think that's okay. But if it's above 50 millimeters mercury, then you have to suspect patients having white coat hypertension. Do you
agree? Sometimes very difficult to diagnose white coat hypertension, but if you listen to the patient, if they feel unwell after taking pressure medication, then we must start suspecting. Yes.
So, any more questions, Prof?
No more questions. Okay, maybe we have to end our session because quite a lot of questions. Okay, and to wind up everything, okay, both of us, we hope that you have enjoyed our duplex presentation, two people for the first time in CMH, and trying to address one of the most commonest topic, high blood pressure. And then if you like our presentation, upload your thumbs up sign, okay? And if you feel that in some way this forum can be improved further, please post your comments, okay? And then we will make every attempt to improve further in our next presentation. Thanks for joining us, and then see you again. Bye, Dr. Lim.
Okay, thank you everyone. Thanks for joining us for this live Facebook talk. Okay, trust me, this won't be the last Facebook talk. So we will do more Facebook talk in the future with more topics. Okay, so if you have any questions or if you want to see a doctor, again, you can make an appointment with NSCMH Medical Center or Marketing, so we can arrange for you to see a doctor or anything. Okay, so I think we end the session today since there's no more questions. Okay, thanks, Prof.
Thank you. Good night.
Thanks everybody. Good night.